Hi, thanks for joining for our video on how to spot the symptoms of COVID-19. As I'm recording this, it's almost winter, so it's very possible that you, like me, have had some symptoms and have thought, is this allergies? Is this a cold? Or is this like the plague that I can spread to people? So lots of good questions to ask this time of year. We'll be walking through what the symptoms are and why it's important to pay attention to them. So there are three primary symptoms when we're talking about COVID. And what we mean by primary symptoms is that most people who have symptoms for COVID will have at least one of these three. So it's especially a good idea to pay attention to these three symptoms. The first one is a fever of 101.4 degrees Fahrenheit or greater. That's the cutoff from the CDC. A cough, and typically that starts out as a dry cough for COVID. It may become a wet cough over time, but typically it does start out as dry. And shortness of breath or difficulty breathing. So these are the three. Any one of these three are definitely a reason to keep monitoring your symptoms, to try as much as possible to stay home and avoid contact with other people if you notice any of these three symptoms and until they go away. There are quite a few other symptoms besides these three that people often report when they have COVID. So a new loss of taste or smell is an interesting one. So for most of these COVID symptoms, it could be COVID or it could be the flu or it could be a cold. For new loss of taste and smell, it's pretty rare that you would have something that's not COVID that gives such a dramatic and sudden total loss of taste and smell. So if you lose your taste and smell, even though that's not considered a primary symptom, that is a good idea to, if I had that, I would probably try to go get a COVID test as soon as possible. So that's one to really, really pay attention to. Some other symptoms, these ones are very similar to cold symptoms. We have headache, congestion, sore throat. It makes sense that these are similar to cold symptoms because what we see here is a new coronavirus. But before that, there were other coronaviruses, which, still are out there and still can infect us. And other coronaviruses cause things like the common cold. So it does make sense that these symptoms are so similar, but also makes it very inconvenient in terms of trying to figure out if we do in fact have COVID. So of course, being as careful as possible, staying home as much as possible with any of these symptoms is a good way to go. Other symptoms include diarrhea, nausea and vomiting, muscle pain and chills, and fatigue. So why is it important as soon as you notice a headache or a sore throat to take that seriously? Well, the reason is especially because once a person gets infected with the virus, so this graph here shows what happens when a person gets infected with the virus and how much virus they have in their bodies. So this is day 0 and day 1 of the infection down here. So somebody gets infected with COVID, and then the virus makes a lot of copies of itself. It reproduces in your body cells, and then it peaks right around day 4 or so of having COVID. And then your immune system kicks in and starts fighting off the virus until it's all the way gone. So typically, people develop symptoms around day 5, but the peak of when there's the most virus and when people are most infectious is right before symptoms start. So even if you just notice a sore throat or a headache and you're like, oh, it's probably nothing, that could be at a time when you are still really infectious compared to the rest of your time having the virus. So as inconvenient as it is to take those things seriously, it is important that we take those things seriously and be considerate of other people's health as well. At the Brenner Literacy Center, we ask people to stay home if they have any of those symptoms until the symptoms go away.